Here's what we have from Dr. Didier Raoult, MD, PhD. He was the Director, Research Unit in Infectious and Tropical Emergent Diseases, Professor of Infectious Disease, Faculty of Medicine of Aix-Marseille University, classified among the 10 leading French researchers by the journal Nature, has over 2,000 scientific publications, has discovered over 90 new bacteria, and first discovered large-size viruses. Obviously, the guy knows what he's talking about. Chris Cuomo doesn't want to believe he's alive, but here's what he had to say. Actually, from all respiratory infections, this COVID-19 is probably the easiest to treat. So there is really no reason to get excited anymore. There is really no reason to get excited and rush to produce a vaccine. Guess what? He's not alone. Next up, Dr. Frank Ulrich Montgomery, president of the German Medical Association, president of the World Doctors Federation, argues that lockdown measures, as in Italy, are unreasonable and counterproductive and should be reversed. He says Italy has imposed a lockdown and has the opposite effect. They quickly reached their capacity limits, but did not slow down the virus spread within the lockdown. A lockdown is a measure of political despair because coercive measures mean that you can go further than the generation of reason. Next, Professor Pietro Vernazza, MD, Chief Physician of Infectious Disease, St. Gallen Cantonal Hospital, found that around 85%, this is the guy, 82 to 90% of all infections occurred without anyone noticing the infection. He's the one that's saying we have a huge asymptomatic carrying body. He says, based on the new insight, we also have to understand that many of the measures that we have implemented so massively today may even be counterproductive. Next, Dr. Shukarit Bhakti, MD. I'm sure I am really beating up these names, but that's not the point. Microbiologist, former professor at Johann Gutenberg University in Mainz, former head of the Institute for Medical Microbiology and Hygiene, one of the most cited research scientists in German history. We are afraid, he says, that 1 million infections with a new virus will lead to 30 deaths per day over the next 100 days. But we do not realize that 20, 30, 40, or 100 patients positive for normal coronaviruses are already dying every day. The government's anti-COVID-19 measures are grotesque, absurd, and very dangerous. The life expectancy of millions is being shortened. The horrifying impact on the world economy threatens the existence of countless people. The consequences on medical care are profound. Already services to patients in need are reduced, operations canceled, practices empty, hospital personnel dwindling. All this will impact profoundly on our whole society. All these measures are leading to self-destruction and collective suicide based on nothing but a spook. Next, Dr. Wolfgang Wodarg, MD, German pulmonologist. This guy's gigantic, former chairman of the Parliamentary Assembly of the Council of Europe. In 2009, he called for an inquiry into alleged conflicts of interest surrounding the EU response to the swine flu pandemic. He says politicians are being courted by scientists who want to be important to get money for their institutions, scientists who just swim along in the mainstream and want their part of it. And what is missing right now is a rational way of looking at things. We should be asking questions like, how did you find out this virus was dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? That's missing. Next, Dr. Joel Kettner, MD, professor of community health sciences and surgery at Manitoba University, former chief public health officer for Manitoba Province, medical director of the International Center for Infectious Diseases. I have never seen anything like this, anything anywhere near like this. I'm not talking about the pandemic because I've seen 30 of them, one every year. It is called influenza and other respiratory illness viruses. We don't always know what they are, but I've never seen this reaction, and I'm trying to understand why. Next, Dr. John Ioannidis, member of the National Academy of Medicine, professor of medicine of health research and policy of biomedical data science at Stanford University School of Medicine, professor of statistics at Stanford University School of Humanities and Sciences, director of the Stanford Prevention Research Center, and co-director of the Meta Research Innovation Center at Stanford, editor-in-chief of the European Journal of Clinical Investigation, former chairman at the Department of Hygiene and Epidemiology, the University of Ioannina School of Medicine. He says patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantined passengers. The case fatality rate there was 1.0%, but this was a largely elderly population in which the death rate from COVID-19 is much higher. If we do not know about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. Hardly terrifying testimony. Dr. David Katz, MD, founding director of the Yale University Prevention Research Center. I am deeply concerned that the social, economic, and public health consequences of this near total meltdown of normal life, schools and businesses closed, gathering banned, will be long-lasting and calamitous, possibly graver than direct toll of the virus itself. The stock market will bounce back in time, but many businesses never will. The unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. Next, Dr. Dan Yeaman, PhD, infectious disease modeler, former faculty member, Center of Infectious Disease Modeling Analysis, Yale University. Are you getting the picture yet? I'm going to keep going, but are you getting the picture? The actual number of people who are sick with the virus in South Korea is at least double what's being reported. So the chance of dying is at least twice as low, standing at about 0.45%, very far from the World Health Organization's global mortality figure of 3.4%, and that's already a reason for cautious optimism. Professor Yoram Lass, former health ministry chief of Israel, former associate dean of the Tel Aviv University Medical School. He says that the new coronavirus is less dangerous than the flu, and lockdown measures will kill more people than the virus. He adds that the numbers do not match the panic, and psychology is prevailing over science. He also notes that Italy is known for its enormous morbidity and respiratory problems, more than 3 times any other European country. He's telling you their hospitals are terrible and they are not the healthiest people. And this, one of really, Dr. Gutcha, founder of the Cochrane Collaboration, who has been investigating scientific fraud worldwide for decades. This is a brilliant scientist. He's published more than 75 papers in the BMJ, Lancet, Annals of Internal Medicine, and New England Journal of Medicine. All right? This guy will never want to lead anyone astray. I guarantee you he has no goal to put people in harm's way. Look what he has to say. On the 8th of March, I published in the BMJ about this. I wrote, what if the Chinese had not tested their patients for coronavirus, or there had not been any test? Would we have carried on with our lives without restrictions, not worrying about some deaths here and there among old people, which we see every winter? I think so. He goes on to say, almost everyone I talk to, lay people and colleagues, I am a specialist in internal medicine and have worked for 2 years at the Department of Infectious Diseases. All of my colleagues and friends consider the coronavirus pandemic a pandemic of panic more than anything else. The WHO estimates that an influenza season kills about 500,000 people, or about 50 times more than those who have died so far during more than 3 months of the coronavirus epidemic. Should it turn out that the epidemic wanes before long, there will be a queue of people wanting to take credit for this. And we can be damn sure draconian measures will be applied again next time. But remember the joke about tigers. Why do you blow the horn? To keep the tigers away. But there are no tigers here. There, you see? You see, Peter Gutcha is giving us a warning. He is saying we are going through draconian measures that are not warranted. We have seen this year after year after year. There are no new numbers here. But when nothing happens, they will say that it was the quarantine and the lockdown of the world that achieved this, the lack of death and disease. when we know that's going to be the case scientifically. And if we allow that to be the message and the story from mainstream media funded by pharma, working on a hundreds of billion-dollar vaccine, if we let that be the story, not only will we probably be forced vaccinated, every time we have a virus in the future, every new flu season, we will have to quarantine.